Now it's time for Quick Take by the Numbers, where we give you the numbers that tell the story. This morning's number is 7.6 million. 7.6 million Americans are expected to place bets with online sports books for Sunday's matchup between the Kansas City Chiefs and the Tampa Bay Buccaneers. That's according to the American Gaming Association. It's an industry trade group. It's a 63% increase over last year and the most ever, according to the organization. Overall, though, about 23.2 million Americans are expected to gamble some $4.3 billion. It's quite a decrease in betting from 2020, when 26 million people planned to bet $6.3 billion on Super Bowl 54. That's according to the group. The online shift accelerates a trend that began back in 2018 when the Supreme Court struck down a law that effectively outlawed sports betting in all but a handful of states. Since then, 25 states and Washington, D.C. have passed laws to legalize gambling. That's according to the AGA. And lockdown drove people online, perhaps not surprisingly, fueling an 80% increase in betting on mobile devices. Well, in just 2 days, 25,000 people will make their way into Tampa's Raymond James Stadium to cheer on the Bucs and Chiefs in Super Bowl 55. The NFL is hoping the event will not be a super spreader, and Bloomberg estimates that over 50% of those in attendance have some level of immunity. Here with more on the NFL's plan is Bloomberg's Miami bureau chief, Jonathan Levin. Jonathan, thanks so much for being here. Explain this 50% figure. This is between actually having had the virus and being vaccinated?
That's correct, Tim, and thanks for having me. Yeah, so part of the NFL's strategy was they purposely invited 7,500 fully vaccinated healthcare workers. And in part, what the league seems to be thinking is, this is an opportunity to give thanks to very important members of our community. But it also means that a significant chunk of the crowd of 25,000 is guaranteed fully protected, right? In addition to that, we have all this incredible data at this point that gives us a sense of what the rest of the public looks like, right? So we figure that of the balance, beside those 7,500 healthcare workers, you're getting close to about 1,500 who would have been vaccinated through some other means, and they've probably had at least the one dose, the first dose, which gives some measure of immunity, right? Beyond that, there are probably more than 4,000 who have acquired the virus in society and have developed antibodies that way. So, it's a bit of a back of the cocktail napkin. There's a lot that we don't know. There's still so much we don't understand about whether or not people who have immunity can still spread the virus and so forth. But it gives you a sense of the cost-benefit analysis that the NFL and the city of Tampa are probably doing right now.
So you spoke to a University of South Florida epidemiologist who said he'd rather be at the Super Bowl than at a house party. I should note that you did say that he's a diehard Bucs fan, so that's part of the reason, of course. But how dangerous is it to be at the game, according to him?
Yeah, well, again, the thing is the NFL has put all these mitigation measures in place, and part of it is the immunity, and part of it is the things that we've learned work so well against this virus over time. They're spreading people out. They're dividing the seats into these sort of pods, and of course, they're guaranteeing that everybody in the stadium is wearing a mask. And the science has told us over the past 11 months that we've been going through this, that just doing those things make a huge difference.
What do you know about who is attending, who's not a healthcare or frontline worker?
Well, we don't really know much, but again, what we did in our little model was essentially do an extrapolation, and we assumed that the crowd is going to be roughly representative of the U.S. broadly. You can actually get a little more granular, and if you assume that half of the crowd is from the Tampa area and half is from the Kansas City area, we have estimates that suggest that roughly 1 in 55 residents of Hillsborough County may be currently infected with the virus. It's about 1 in 25 in Jackson County, where Kansas City is located. So, again, it gives you a little bit of a sense of how much of a risk is this. You have about 1,200 susceptible people. If those numbers stand, maybe somewhere between 50 and 400 people, 400 on the pessimistic end, could end up getting infected at the game.
So I do wonder about the context of last year's Super Bowl, because as you mentioned, Governor Ron DeSantis talked about how it could have been floating at the February 2nd game last year. That, of course, was hosted in Miami. That's the backdrop. I'm wondering about the economic risk, or the risk of hosting it this year in Tampa. The economic benefits to the city of Tampa, do they outweigh the risks?
Yeah, the tricky thing about this pandemic is, everything is so gray. It's never black and white. And what epidemiologists tell me is you can't hold an event like this. No matter what you do, you can't hold an event like this without some level of risk. And so what policymakers are doing is they're trying to decide, do we walk away from the economic benefits when we've already invested so much in bringing the game to the city of Tampa because of the risks we know there. One thing we can say for sure, we as a society have come a long, long way in the past 11, 12 months. Ron DeSantis, the governor of Florida, has said it's conceivable that the virus was circulating way back at the last Super Bowl in Miami Gardens, but the circumstances would have been entirely different. We wouldn't have even known it was there. We would have known nothing about the mitigation efforts that we know today. And of course, there was a full crowd in that stadium. This is going to be the smallest attendance in the history of the Super Bowl.
Jonathan, I'm throwing you under the bus here, but who are you rooting for?
To be honest with you, I'm a longtime Philadelphia Eagles fan, so I like Big Red Andy Reid.
All right, there we go. Bloomberg's Jonathan Levin, thanks so much for your time.